Next, let's look at billing and patient payments. To access patient payments, you're going to go to billing and go back to charges and payments or your F6 screen. We were just working there in charges. Now we're going to look at this section for posting payments. Both insurance and patient payments are posted from this menu. Additionally, you can also use the hyperlink or shortcut menu for charges and payments here. With the charges and payment screen open, you can key in your patient account number, including the .0, .1, etc., or you can pull up your patient by name. Let's go ahead and pull up Karen Jones because we posted a charge on her earlier. Remember, she's up top and she has multiple sub-accounts. I can double-click her in either place. I'm going to go ahead and just double-click at the bottom. That takes me into the patient sequence screen for account number 210.0, Jones Karen, and I can see that my day sheet date is 11/13. And that's good because Karen gave me the copay of $15 on 11/13 by check, and that's how I want to post it. I come and I find the date of service for 11/13. I also see that I have that blue bar that's looking for a copay to be posted. Once I highlight that row by simply clicking on it, left-click mouse just the one time. If I double-click, it's going to take me into the sequence and I can see the charges. That's not what I want, so I can just hit exit window and go back one screen back to the sequence screen. With that row highlighted, I just want to hit my charges and payments or my money bag icon. Additionally, if you want to use a keyboard shortcut, Control-R for the payment will get you in there. Control-R, just think of Control Remit. Remit is remitting payment. That takes me into the payment screen. Up at the top, I can see my charge, my 99213. And I can see that it's trying to post a primary payment because that's the order of payments expected. However, MicroMD will allow you to use this toggle button and say, no, I'm not posting the primary payment. I haven't even sent the claim out the door yet. What I want to post is a payment for a patient or non-primary insurance. So whenever you need to post a secondary payment or patient, you're just going to hit the toggle button and it's going to take you into the blue calculation window. Let me go back and do that again. With the row highlighted for data service 11/13, I hit my payments and adjustments. Takes me into the green payment window, which is for primary insurance payments only. You never want to post anything except primary payment into this green payment calculation window. Posting in the window is extremely important. The system will allow you to click here and post a payment had you received one, but it will not apply it appropriately. So try at all times to avoid coming up here. Make sure that if you're posting a payment, you're putting those money or dollar amounts down here in the bottom section. Let me go ahead and exit because I really don't want to make that payment. So recapping, I go to my charges and payments. I pull up my patient, typing in last name, comma, first name, or account number. Or if I was in this patient last, I can hit my F12 key. It'll go right into that account. From the patient sequence screen for this patient, I'm going to highlight the date of service by clicking on it one time and then choosing my payments icon. Because I am not posting primary insurance, I know I must hit the toggle button to take me into the blue calculation window. Everything except for primary payments gets posted in this window. This patient gave $15. I want to put that in the bottom section and hit my disperse button so that it'll disperse that money. And I want to tell it what code. Right now it's looking for insurance, the code 31. If I double click in here, or if I put %, I believe that's a 31, yeah. So let's put a % sign or single % sign, and let's go down to code 31. It was wanting to post a 31, which is a payment for healthcare. That's not really what we're posting. This patient gave us a check. On your system, number 1, 2, and 3 are normally, and yours won't be Medicare. Payment code 1 is cash, 2 is check, 3 is charge card. I'm going to choose check because this patient gave us a check for $15. With all of this information correctly input, I drag and drop this dollar bill right from here up to my payment line. Your payment line is the bottom section of your screen, highlighted in yellow. The top section is only a reminder of what the charge is. That's highlighted in green. So remember, you're going to drag and drop the dollar into the payment line. Now let's say I made a mistake and I had put $10. And in actuality, the check is $15. Until I hit save, I can change that at any time. I don't want to click here and change it. I want to come here and make it $15, disperse again, and re-drag the dollar. Watch what happens. It's going to overwrite that line with the appropriate information. Once it's correct, I can save it. And let's just say that the check number was 4321. I want to put my check number. Because if I ever want to conduct a search on that check number, I want this particular payment to come up. And so when I'm done, I'm going to hit save. The system's automatically going to apply that money. And once the day sheet is closed, this copay line will go away. Notice also that it reduced the amount owed on that sequence by the $15. And that's all you have to do to post your patient payment. Let's go look at a couple more examples. So we know Jenkins Burton was another patient. With my schedule open, and I'm moving my schedule. Remember how we learned how to do that before, so that I can open payments and adjustments, and I can key in my patient name. I'm going to start with this very first one, Jenkins, and I can do a partial search. I'm just going to do Jenk, and I'm going to do BUR. I'm pretty sure this is the same one. If I wasn't sure, I could certainly set the screen up where I could see a phone number, or I can hover and I can see that their chart number is 779, and I'm going to come in here and I can see the chart number is 779. So this is the right patient. 1113, I could have also used date of birth. 1113 is the date of service that I want to post a copay. It's showing me here what the copay amount is. Also, if I hover, it's showing me a $15 copay. We'll go ahead and post this payment for this patient. Remember, we, with the row highlighted, hit our payments and adjustments. Automatically, it wants to post in our primary insurance. We're not posting primary, we're posting patient. Only primary insurance would get posted in the green box, so I have to hit my toggle button, which takes me into the blue calculation window, and that's where patient and all payments other than primary insurance are posted. Key in my $15, hit my disperse button, and tell it if it's cash, which is the number 1, check, or charge. We'll go with cash this time, and I'm just going to drag and drop that dollar onto the payment line. It's indicating that today's date there is a cash payment for $15. Now, notice what happens with the balance here when I do that. Let me go ahead and delete that row, and let me go back into the sequence and say no saving. Alright, payments and adjustments, because it's already highlighted on that date of service. Look at our account balance of $66. I'm toggling to go into my blue calculation window because this is a patient payment. Dragging I didn't set my code type. So it's looking for a UHC payment. And I realize that's wrong, so I just come here, backspace, and put my 1 and drag again, and it's going to change to cash. That's what I want. And I notice now my balance is dropping to 51 from 66 because of this posting, which is what I expect it to do. When everything looks the way I expect and I'm good with it, I can hit save. And it's posted that copay. I would continue posting all of my time of service payments or any other patient payment. Okay, so next, let me close out of the schedule, and I'm in my charges and payment screen again. I just hit my F6 key on the keyboard to do that. So I'm going back to charges and payments, and this time I want to show you how to post for a patient that has multiple dates of service. So I'm going into account number 4.5 because if you'll notice, this patient has a couple of different patient dates of service that are due, and she's presenting and just asking, how much do I owe so I can just pay off my account? Well, you don't want to have to go into each individual sequence to post for the patient. And so we have a feature in MicroMD called Uniposting. And Uniposting will allow me to open and tell the patient how much they owe. I can tell them from here, patient balance is $199.69, and she says, okay, I'm going to pay you by check. So I would put my check code number 2. The check number is 6464, and she's going to pay the full amount of $199.69. Or let's just do an even $195. We'll just say $195. She says, well, the most I can do is $195. Well, posting $195 will take care of this data service and most of this data service, and that's fine. By default, the system is going to post that money first in, first out. I need only enter the check one time, and once I'm complete with that entry, I'm just hitting my save icon here. I can also print a receipt right from this window for the patient. So when I come back in, you'll notice that now I only have a patient balance left of $4.69. So Uniposting allowed me to quickly go in and post the payment. It took the full payment on the first line item, and then it did a partial, indicating the check number in both places. So to recap on patient payments, you're going to use your charges and payments, either the shortcut link, your F6 shortcut key, or go to billing and charges and payments. You're going to pull up your patient account. You can key it in by name or key it in by account number. And once you locate the patient account, you would double click to go into the patient account. If you're wanting to pay several dates of service at one time, you'll want to use the Uniposting feature because that allows you to enter a single check and total payment amount, and the system will automatically apply it over the different dates of service in which the patient owes. If you're wanting to only pay for a particular date, you highlight that row and you choose your payments and adjustments link or money bag. And then don't forget, you must post only in the blue calculation window for a patient or non-primary insurance payment. You would enter the amount into the box in which you were going to post for that patient. It could be the full amount or a partial amount. And you would hit disperse, making sure to set the code type 1 for cash, 2 for check, or 3 for charge if you accept charge cards. Once you've set that up, drag and drop your dollar bill. The system will show you that you're posting for today's date a code of number 2, which is a check payment, check number 1234, in the amount of $20. If something is incorrect, simply correct it on the bottom of the screen and then drag the dollar again. It will overwrite and correct the line item. Once everything is accurate, you simply hit the save icon to post a payment. If you need a receipt for that patient payment, check the line item and hit print a receipt. As you post payments in the system, and the day sheet is going to track those payments. So I can come in here and choose just my username as we did in our day sheet training class. And I'll be able to see all of the payments that I've been posting, including my voided transactions from earlier. You can see my payment and it indicates whether they're check or cash. Additionally, as I scroll down to my day's totals, it's going to help me to balance and know what deposit I'm going to have for the bank. It's also going to tell me how much of that should be in check and how much should be in cash. This concludes billing for patient payment entry. Next, we'll be reviewing insurance payment entry.